everybody. Thank you so much for joining me this evening. I am here with the amazing Ian Wright, parasitologist, not footballer.
No, that would have been more amazing, wouldn't it? But I think he probably knows less about parasitology, although I'm not sure. I mean, who knows?
There's always that small piece of confusion from some people, I find. Anyway, we're here this evening to talk all about foreign rescue dogs and the diseases that we should be testing them for, because there's a lot of them coming into the country at the moment, which is marvelous. It's wonderful that we're able to give these dogs home, but estimates are in the tens of thousands. The last figure I saw was 50,000 at least coming into the UK every year, which is a humongous number of dogs.
It is.
There are 8 million dogs in the UK. So as a proportion, it's not that many, but there's certainly a lot. And unfortunately, they are coming in from countries that have diseases and parasites that we do not have in the UK, and we would rather like to stay that way.
Absolutely.
So this chat isn't about why we shouldn't bring them in. This is about what we should test them for before we bring them into the country. If they turn up with a positive result, what we should do about that, and how we can help mitigate any risks, because if we bring in diseases and parasites that we don't have in the UK, we put our own dog population at risk, and in some cases we put human health at risk as well. So it's really, really important we get this right. So Ian, tell us, I really want you to tell everyone watching about you. Who are you? Why are you so good at parasites?
It's all relative. I mean, there are more learned people than me about parasites.
Not many.
I'm a first opinion vet, like yourself. So in a lovely little corner of Lancashire called Fleetwood, some of the viewers may know it. And I treat sort of pets day in, day out. But I do also have a sort of special interest, not an obsession, but an interest in parasites. So took a master's before I got into vet school, and I've pottered in research since then. I write articles, like to keep abreast of events, and that interest has led to me being head of ESCAP UK and Ireland in the UK. And what we do is very much what we're going to do tonight. We just give advice and information about parasites. So hopefully, we're all on the same page, and we all know what testing to do, what treatment to give, what parasite risks there are.
Amazing. So let's jump right in with the headline. Ian, what should we test foreign rescue dogs for? What should be the list of things that they should be screened for before they come into the country, or if it hasn't been done, after they get here?
Okay, well, gosh. So if I had my way, it would be a long list, a very long list. But I understand we have to prioritise a little bit. So broadly speaking, there's 4 that I would be very concerned about. So one, it pains me to say this, but isn't really a parasite, but comes in on the fringes, and that's Brucella. So again, some people listening may have seen this in the veterinary press or the general press, that Brucella cases are being detected from dogs coming into the UK, primarily from Romania. I don't want to pick on one country. I've had to say this before. I love Romania. Romania is a wonderful holiday destination, but it is full of exotic parasites, often from different parts of the world. It's a real mixing pot. And it's got a very, very high prevalence of Brucella. So there's a strong likelihood that dogs coming from that region, from Eastern Europe, from the Mediterranean as well, are going to be positive for this bacteria. And it carries really quite significant zoonotic risks. So it's going to put people's health at risk. And there's the risk of it establishing in the UK without dogs that are carrying it necessarily showing a huge number of clinical signs. So ideally, it would be nice if testing was compulsory. But at the moment, in the absence of that, I think we absolutely should be doing some sort of screening test. Serology is very good as a sort of broad net for trying to pick up cases. Just so, we can try and get a sort of handle on which dogs are infected and the risk they're going to pose to their owners. So that would be my big number one. And that's a relatively new player, but it's the one that I'd probably go for first.
Yes, there are rising numbers of Brucella. So Brucella is a bacterial infection. That's right, isn't it?
Yes.
And
Yeah, absolutely. Yes.
and the concern is, particularly with Brucella, that it can pass to people, and it can make people quite poorly, can't it?
Well, yes, particularly the immune compromised. I mean, fatally ill at its worst, but certainly, morbidity. So how unwell you're going to feel and how long you're going to feel ill for is pretty high. So, out of all the pathogens we're going to talk about in terms of human health, it's kind of funny because it's not a terribly high profile one, but it's the one that, is probably going to do you the most mischief, apart from Echinococcus tapeworm.
Yeah, I think it's one that we're going to hear a lot more about actually in the next year.
Definitely.
The government released a sort of a mini statement paper on it in February, and I think we're going to start to see it become more of a concern. So we test for Brucella with a blood test. So you're suggesting that every foreign dog coming in from Romania or Eastern Europe should be screened for Brucella?
Well, I mean, ideally the Med as well. Southern Europe, there's been quite a few cases reported. I mean, there's almost no country in Europe where cases haven't been reported. But if we're going to focus, Eastern Europe, south of Europe would really be my main concern areas.
And they're not always sick, are they? So dogs can carry the bacteria, but actually be very well in themselves.
Absolutely, yeah. So the majority of dogs are going to be absolutely fine. If they're not, then the most common signs, because it's a reproductive disease, let's say the most common signs tend to be, downstairs, but if they're not there, if they're lurking elsewhere, then you tend to get, bizarrely, next most commonly is inflammation inside the eye. And spondylitis, so back pain, sort of neurological signs. So those are the next most common. You do often with Brucella get raised lymph nodes as well. With lots of the diseases we're going to talk about, raised lymph nodes are a very common clinical sign. So just something to watch out for in general.
And it's passed to humans from the dog's bodily fluids, isn't it?
Yeah,
is that
absolutely,
right? And seminal fluid and things like that. Can it be passed in saliva, or is it mainly
it's theoretically, so not directly from saliva, but as we know, I mean, my own dogs love to lick pretty much every part of their body, but some parts more than others, and then love to lick you, and if your dog's not showing any clinical signs, lots of us enjoy a bit of facial snuggling with our dogs, and if they've just licked somewhere unpleasant, then you can see the potential for physical transfer to take place, and that's the worry. It's not a very pleasant thought, but it happens.
Well, it's true, isn't it? And I think particularly because I know there's going to be quite a few veterinary professionals watching this chat as well, because there's a lot of interest. I think we should maybe be starting to consider to protect ourselves, and potentially considering wearing gloves and things to handle, which might not, because, sometimes the owners of the dog, not at the minute because they're not in, but might take that a bit personally. But it is an extremely serious infection if a human catches it, isn't it?
I think it can be broached in a sort of very practical way. So you can say, look, this isn't just your dog, but this dog's coming from another country. This is the first time I've examined him. So just to be safe, I'm going to put a pair of gloves on. And bearing in mind that dogs coming from endemic areas, we really should be, in all seriousness, examining their sort of reproductive organs. I don't think wearing gloves for that is unreasonable. I think that most owners will understand the need. So, I think increasingly, if you look at the number of zoonoses from abroad, so, diseases that people can catch, I think, vets and nurses wearing some protective gear just on initial exam isn't unreasonable. And I think it's something that we've all got more used to seeing as well, in recent times. So.
Well, this is true. And I do know that of the dogs that have been diagnosed with brucellosis in the UK, unfortunately, I think the majority have been euthanized after diagnosis because the risk of passage to humans is so great. And certainly, I think if we get a positive result in a foreign dog in a country that deals with it anyway, I don't think we can in all in all seriousness, import that dog. So I think that would have to be a big black mark against it. Unfortunately for that individual, if we're testing them out there, we really shouldn't be letting them in.
Yeah. I think we have to be a bit careful in as much that if we were going to make testing compulsory, or if we're going to promote testing, then we'd want a test that is going to catch all the positives dogs. So something like serology, but you are going to get false positives if you do that. So a little bit like FELV testing. You know, if you get a positive, you shouldn't, particularly if euthanasia is going to be the outcome, you shouldn't then assume that that dog's positive. You're going to have to go on and do more tests. But it's the other way around, really. If you do that serology testing and it's negative, you can say, look, that is eliminated, and we can sort of, you know, move on. But, you know, no, I mean, if those tests are confirmed, or if serology is making it look very likely that it is a genuine positive result, unfortunately, this is an organism that is extremely difficult to eliminate from dogs. Almost impossible, I would say.
Well, yeah, that's the other point, is we can't get, once it's in their system, we can't get rid of it, can we? So
it's very hard. Yeah.
Someone's just asked, is it notifiable? It isn't at the moment, is it? But it wouldn't surprise me, particularly if numbers rise and knowledge rise, that it does become a note, which means that if it's diagnosed, it has to be officially reported and to the government and followed up in that case.
I think it's crazy that it isn't now. I mean, you know, if you really think about the ramifications, you know, it really should be now. But in terms of sort of pet importation rules, its zoonotic risk makes it a really good candidate for compulsory treatment being introduced, compulsory testing, being introduced. So, you know, certainly something for us to promote, you know, lobby for.
Yeah. Okay. So, and if somebody has a dog from one of those countries that hasn't been tested, we can run that testing in the UK. You know, you can ring your vet and we can run those blood tests, and then if it's positive, that's wonderful, and if it's positive, then we can discuss what the ramifications of that might be. But that's a brand new headline as well. It's not a disease that I'm aware of, particularly until maybe like a couple of months ago. So I think once you know, these other health problems that are filling the news, you know, stop talking about it.
It does feel like everything else is coming in second at the moment, doesn't it? But yes, I think this is quite important.
So, but let's now go on, and what I think brucellosis stands on its own. Yeah. But just run me through. We're going to talk about each individual disease and parasite as we go. But what I really want is a bit of a menu, a bit of a tick list of things that, you know, if vets are looking at newly imported rescue pets and asking questions if they've not been done, we can run them. But also if you as a pet owner are considering adopting a dog from abroad, the kind of things that the rescue centre, and there are some amazing, reputable, wonderful charities out there testing until they're blue in the face before they bring their dogs in. Unfortunately, there are probably more that are not doing that. And so if we can, what I really want to do from this talk today, one thing I really want to come out with is to arm people with the information that they can say, well, have you done these tests? And if the charity says no, then that may well not be the charity to support. So what other things should our dogs be tested for?
So the big three I immediately want to know about, often to eye rolling from, you know, my support staff or from the poor people who have just adopted this pet and brought it in. But almost straight away, I want to know, has it been tested for heartworm? You know, has it been tested for Ehrlichia, which is a tick-borne pathogen? And has it been tested for Leishmania? And the reason for all of those aren't necessarily that they're very likely to establish in the UK, perhaps with the exception of Leishmania. It's actually very unlikely at the moment that these pathogens would establish. It's really for the health of that individual pet. So what those three pathogens all have in common is that you can get disease from them months or years after that initial infection. So they'll arrive completely healthy. And the person who's adopted this dog will think, oh, it's a lovely, healthy dog. It's passed all its health checks. But, you know, the disease can then take place, you know, months or, you know, many years after importation. And sometimes if the dog changes hands, then that sort of travel history is lost. and as a differential, for possible sort of heart disease or, sort of thrombocytopenia, sort of low platelets, low red blood cells, all of these things, this travel history and these pathogens can be lost. So establishing whether they're there and testing for them very quickly is actually very, very important. So in terms of which tests I'd run, one of the first ones I would run is a patient-side test for heartworm. Now, there's a bit of, sometimes people go, oh, it's a patient-side test. It's not quantitative, it might be wrong. But one of the really useful patient-side tests is antigen testing for heartworm. Many are available, but some of them also have tests for other pathogens. So I'm not mentioning any trade names or any individual tests. But for instance, one of them also has antibody testing for Ehrlichia. So if those are two of your big worries, those are two things that you could test for together.
So Ehrlichia is
it's a little bacteria, that lives inside cells and is transmitted by ticks. It's a tick that we don't have often in the UK. It's one called Rhiphocephalus. It likes tropical climates. But dogs that live in endemic countries, so in Eastern Europe and Southern Europe, very frequently get infected. It's got a very high prevalence, very large numbers of dogs positive for this pathogen. And what happens is that dogs get infected with it, and often they'll just eliminate it, or they'll become carriers with no clinical signs. But then, as I've said, will become very, very ill, often fatally ill, months or years after that initial exposure. But the heartworm, that is a really good test that you can do. So I would do that. And the tick-borne pathogens, you can either do by what's called PCR, so you can look for little bits of them in the bloodstream, or you can, in the case of Ehrlichia, you can look for in terms of antibodies. So that's sort of, two different ways that you can look for.
And these tests can be run in the country of origin as well as here, can't
Absolutely, they? Yeah, absolutely. And PCR testing, I mean, a charity would have to have access to in-house PCR facilities, but PCR testing is actually getting cheaper and can be run in practices now. So, there are machines that will do PCR panels for a whole range of parasites. So it is getting cheaper to do. So if we're looking for
so that's heartworm and Ehrlichia. We'll come back and try and cover the individual diseases initially, but so we want a tick next to have you been tested for heartworm? We want a tick next to have you been tested for
Ehrlichia? Yeah, and then a tick for have you been tested for Leishmania? And that's easily, out of all the ones we're talking about, that's most easily the trickiest one to test for. It can be a bit difficult to pin down.
So and how do we test for Leishmania?
So Leishmania, there are two different ways that you can test for it. So the first question is, has your dog got any clinical signs when he arrives? Or she. If the dog arrives and it's got clinical signs, then you've got areas that you can target. So you could biopsy some lymph nodes, you could do some fine needle aspirate on some lymph nodes or some affected skin. And you can either send that off for histology or cytology. So you can look for the little parasites in the tissues.
I have to say, I'd be fairly horrified if a dog with active Leishmania lesions, so active signs of Leishmania disease, was being imported. Unfortunately, I think it does happen, but I think
now I think probably what you're imagining is a little bit more dramatic than how some of them present. So some of them present just a little bit of hair loss, or perhaps raised lymph nodes that nobody's noticed, but you can still target those tissues, and they're really good tissues to run PCR on. So if you send them off to a lab, the lab can run PCR on those tissues, and that is a very, very sensitive test. The trick comes when we're going to screen healthy dogs. So the way to do that is either to do PCR on the conjunctiva, so just the surface of the eye. So you can run a swab round and send that off for PCR, and that's going to pick up, well, probably around about 4 in 5 positive dogs. So that's sort of one thing that you can do. What I like to do is to do quantitative serology. Now, that's where you're looking for antibodies in the bloodstream. Now, antibodies doesn't mean that a dog's currently infected, but if you've got very high antibodies, that's quite suspicious. But if it's quantitative, you get a number. So then if you retest the dog 6 months later and it's got more antibodies, or it's got the same level of antibodies, then you can be pretty confident that you've got infection present. And if you've got antibodies climbing in a clinically affected dog, you can sort of marry those two things and alarm bells should be ringing. So, you know, those are the two sort of really useful tests to perform.
So if a foreign rescue, and so Lishmania is hot places, isn't it? So that's like Mediterranean climates.
Well, yes, it is. It started to branch out. It's moved up into Eastern Europe, so it's seasonally present in Romania, Bulgaria, some of these Eastern European countries. But it's also seasonally moves up into France. So during the summer months, it can get into mid-France. You know, so perhaps areas that you don't quite expect. You have to be a little bit careful. There's a significant percentage of German dogs that are positive for Leishmania, and that's not because it's being transmitted in Germany, but just because of the sheer number of dogs that have been imported from endemic countries into Germany. So then if those dogs are moved on and rehomed, they could be positive as well. So you can't assume that just because a dog's coming from a non-endemic country that it hasn't got Leishmania. I'm afraid we're not the only country that lots and lots of dogs are being imported into, and it creates a sort of mixing pot where it can be more difficult to predict where these parasites come from.
So Leishmania is, let's go slightly off topic because I think that's a really interesting point. So Leishmania is spread by sandflies, and we currently do not have sandflies in the UK.
Yeah.
There have been reports of dog to dog and dog to human spread, but they are relatively speaking sporadic. But is that work in Germany showing that non-travelled German dogs are becoming more likely to be positive for Leishmania?
No. So there's a few points you've said there that I need to pick up on. So first of all, in immunocompetent people, there hasn't been a case of direct transmission from a dog to a person. So the zoonotic risk in the absence of sandflies is very, very small, or almost infinitesimally small, as long as people are sensible. Yeah, so we don't want to sort of panic people on that front. But there have been cases, both in Germany and in the UK, of dogs that have basically obtained the parasite without the sandfly. Now, in one case in the UK, it was living or had lived with a positive dog. In the other case, it hadn't. So it's not entirely clear where it got the parasite from. There are known modes of transmission that don't involve sandflies. So it's always important to get a history of, was dad or mum imported, or their grandparents, because this parasite can be transmitted from one generation to the next. It can also be transmitted sort of through sperm, sort of through sexual interaction. So there's that route, but also there have been reports of it being transmitted through bites. Blood transfusion is a very common route in sort of non-sandfly countries, and rightly or wrongly in the UK, it's not tested for before blood transfusion in the UK. Really? So we need to be sort of very careful there. Sometimes we just don't know. And it's been suggested that possibly it may be being mechanically transmitted by things like biting midges, maybe. But we don't know, is the short answer. So just because we don't have the sandfly doesn't mean we can assume it's not going to become endemic. I mean, that's not what's happened in Germany. It's just huge numbers of dogs have been imported into Germany. So, you've now got just a significant percentage of German dogs positive just because they've all been imported.
Right. So the dogs that are positive are are imported dogs. They're not German born and bred. So that's right. That's what your statement just slightly panicked me. That
no. But what I'm saying is, if you have a dog imported from Germany there's every chance, particularly say if it had behavioural problems, or sort of if costs couldn't be afforded, or if it was just moved on, that it may be a dog that's actually come originally from the Mediterranean or from Eastern Europe.
Yeah.
Certainly a lot of that is happening, say, in Romania, where a lot of dogs will come into the country from the Middle East, from Asia sometimes, and then be moved on. So just have to bear in mind that just because it's come from one country doesn't mean it hasn't been present in other countries.
Doesn't mean it started there.
No, absolutely not. No.
So we should be testing for Leishmania. If the Leishmania test is done, because a lot of charities now test for Leishmania, I think it's a very, very common one that people know about and are keen to do something about. If the test for Leishmania comes back as, is it possible to get a negative test, or do you just have a low titer result on the blood results? If a dog's negative, are they genuinely, can we sort of slap a big gold star on it and say you're clear?
No. If only gold stars were so easy to obtain. So right. No, the problem is that it takes time for these antibodies to develop. And similarly with heartworm, it takes time for heartworms to grow up and start producing baby heartworms. So, when they first come in, if they test negative, they really need to be retested 6 months later. If you've got negative serology after 6 months in the country, you're looking pretty good. I mean, there's always the exception that proves the rule, but if you're negative after 6 months, that's looking pretty good. I would say for heartworm, if you're sort of negative, say, after 9 months, you're pretty much in the clear. But, you can't assume if these tests are negative on arrival, it doesn't mean that they're going to be negative in 6-9 months' time. And that does catch a lot of people out.
So even if these dogs are tested negative before rehoming, so they're tested in the country of origin, you would advise that all of our foreign rescues are then retested 6 to 9 months later for both heartworm and Leishmania before we give them a clean bill.
Clear. Yeah, absolutely. Yeah.
Just touching on heartworm, someone has asked the question that rescues are saying that heartworm testing is not done in young animals.
Yeah, for just that reason, yes. So well, bearing in mind, I mean, they shouldn't be coming into the country until they're sort of 4 months old. Yeah. But testing for heartworm isn't done until they're at least 6 to 9 months old, because the heartworms, you're testing for adult heartworm antigen, and it just takes time for the heartworms to mature. So yes, if you've got a sort of a puppy, if you've got a dog that's say 4 to 5 months old coming into the country, then you'd wait, before heartworm testing it. In which case I would wait, just to save money, really. I'd wait until they were 9 months old and then test them. Cool.
And then if we've got if you have a positive Leishmania dog, now because there's a lot of dogs with Leishmania or Leishmania in the UK, isn't there? Because I think it's just so common in some of these countries. We'd struggle to find dogs that possibly weren't carrying it to bring in.
No, that's fair to say, yeah.
So if they're symptom free, so because when they're poorly, they get like really crusty skin, don't they? And like you say, these big lymph nodes, and obviously it's swimming around in the bloodstream. They're not infectious to other dogs. How long? It's a lifelong commitment, isn't it? And it can flare. Can it flare at any time, or do you find that over a period of time the flares get less?
No. In fact, the other way, unfortunately. So it's important, if anybody has a Leishmania positive dog, there are some charities, and not all by any means. Some charities are very well educated about Leishmania, and new owners are very well prepared. But I've met owners that have been given the impression that having Leishmania is a bit like just having a bit of a sort of flu inconvenience, and you just take some pills and everything's going to be just fine. But Leishmania shortens the lifespan of dogs that are positive. I mean, it's tragic, really, in that it's a sort of horrible chronic sort of pathogen that doesn't go away, and they do have flare-ups on and off throughout their whole lives. And those flare-ups tend to get more frequent and worse the longer you've had the parasite for. The biggest worry, though, isn't the obvious signs. It's not the big lymph nodes and the skin. It's the fact that immune complexes build up in the kidneys. And that eventually causes kidney failure. And that's, unfortunately, eventually what kills most Leishmania positive dogs. So it's important. You don't necessarily have to start a subclinical dog on treatment, but they do need close monitoring. So every 6 months, ideally, you'd want to check their antibody levels to check for climbing antibodies. And every 3 months, you'd want to check their urine. So you want to check whether it's concentrating, whether the kidneys are working properly, but crucially, the amount of protein in it. And if protein starts to climb, there have been great studies that have shown essentially the more protein you're losing in your urine, the worse your prospects are if you're Leishmania positive. So that's one of the sort of underlying telltale signs that we can look out for.
Yeah. So it's taking on a Leishmania positive dog is quite it is a long-term. I mean, obviously you take on a dog, it's a long-term commitment, but they are a dog with a chronic disease that needs monitoring, treatment, and probably, even if they're well at this point, will require, intervention, and it might well be they've all, we all lose our pets at some point or other, so which is, sad. But yeah, I think it is one of those diseases which I think is a little bit underappreciated by vets as well, vets in the UK as well as owners, I think, because I think we're still this is relatively new kid on the block, really, isn't it?
It is, yeah. I think more and more of us are getting experience of treating it because it is becoming more and more common, but still, yes, relatively new. But it's really the need for ongoing testing. So, that's an ongoing expense. And the fact there are going to be periodic sort of episodes that are going to need treatment, the sort of owners of Leishmania positive dogs need to be prepared for. And it's our job as vets to do that and to say, look, we're fine at the moment and long may it continue, but we may have a rough ride, at some point in the future.
And as long as owners are aware of that and committed and to do that for the pets that they love, then that's wonderful.
Absolutely, yeah.
What about heartworm can be more problematic.
Heartworm is a different kettle of fish, really. It's the same in that many people are packed off with heartworm positive dogs with the news that it's going to be fine. It's going to be fine. Going to take a few wormers. Worms are going to die. Everything's going to be fine. When in fact, some dogs die from heartworm, and unlike Leishmania, where it tends to be a very chronic thing, dogs that die from heartworm unfortunately die suddenly, often from thromboembolism, so from blood clots, and that's the risk. So dogs that are subclinical, that have no signs for heartworm, you have to decide whether to treat them or not. And if you treat them, there is a risk. It's a small risk if they're well rested. But if you treat them, there is a small risk that they're going to die through thromboembolism as a result of treatment. If you leave them, there's the ongoing risk that they're either going to develop heart disease or die from blood clots as the worms die naturally. So, it's a toss-up, but current evidence suggests that you are much better to treat than to leave them, as long as you can strictly rest your dog during treatments. And depending on the treatment regime that you do, you're looking at around 6 to 12 months to clear a heartworm infection. And that's 6 to 12 months of cage rest, effectively, for your dog. Wow. So it's a big undertaking. If you can get through that, then cure for heartworm is very, very possible. You just have to go into it knowing that, that there is the possibility that your new dog might not make it. But, I think, again, as long as clients are aware of that, pet owners are aware of that going into treatment, it's absolutely fine. It just worries me that, people take these dogs on and they go, I've just been told they're just going to have a wormer every month and it's all going to be fine. That absolutely is not always the case. And this is the reason in endemic countries why, almost all dogs are under regular veterinary care, are on preventative treatment for heartworm, is to try and avoid the consequences of infection.
So if we've got a dog in a foreign country who's tested positive for heartworm, so heartworms, like the name suggests, are worms that live in the heart, aren't they?
Big worms, yeah, 10 centimetre long worms in your pulmonary artery and in your heart chambers. I mean, it's a wonder really that dogs aren't sicker quicker when they get infected, given that they are chunky worms. They're not that little things.
So it's not, and so if we get a positive result in heartworm testing, then we know that there are adult worms in the heart. And
so again, we mustn't be confused by the different tests available. So some positive dogs will have been tested for antibodies, and that is only demonstrating exposure to infection. Doesn't mean infection is currently present. But if you test for antigen, then and it's positive, you can be 100% certain that dog has got heartworm. You may then have to go on an ultrasound to try and establish how many. Another very useful test for heartworm is something called the Knots test, which more and more external labs are doing, or you can have a little play in your lab. I can send a sort of protocol, but you're basically just spinning down the blood with some formalin, so that bursts all the red blood cells. And then you're just examining the sediment and you see larval worms on the microscope slide. Now, unless you're a real pro, and when I say that, I often can't tell the difference. So like a real pro, you're probably not going to be able to tell whether it's heartworm or, say, Dirofilaria repens, which is a skin worm. But if you've got larvae on your slide, you've got something. So you then want to go on and either read an antigen test, or you want to sort of, if you can demonstrate that you're negative for heartworm, you've probably got skin worm that needs treating instead. So, doing something like a Knots is a very useful backup test, just to be as certain as you can be that there isn't heartworm present.
And if we've got a positive result on a heartworm dog, say before it's imported, and I guess on some levels there's no issue with importing that dog because heartworm isn't heartworm is currently not transmissible between dogs in the UK, is it? Because that needs a mosquito. Is that right?
Yes. So again, sort of confusion. So we do have the mosquitoes that can transmit it. They're all over the UK. They're like, eat me alive every walking holiday. They're very real. They're absolutely here, but they don't live long enough because of our mean temperatures at the moment for heartworm to survive. So it can't be transmitted because its mosquito vector doesn't live long enough. As we have global warming, say if we come back and have this conversation in 5-10 years, it may be possible that it's going to establish, particularly in the south of the country, but at the moment it's a no. So, at the moment we're okay. It's more for the health of the individual dog that we're concerned.
Yeah. And although heartworms do respond to the kind of wormers that we give our dogs, just for any old worms, the problem is that if the heart is rammed with adult worms and then they all die at once, you've effectively got a great big lump of adult dead worms whooshing through your arteries and veins, aren't they? And then that can cause...
Well, that's the risk overall. There's two risks. One is that you're going to get a blood clot from the adult worms dying. The other one is that you're going to have an anaphylactic reaction as all the larvae die in the bloodstream. And that's another reason that the Knots test is useful. It'll tell you how many little baby worms you've got in the bloodstream and how likely an anaphylactic reaction might be. And if we know there's lots of them, we can give medication to try and head that off. We can be more aware that might happen. But it is quite important to know in advance before you start treatment.
Don't you give like a low dose of wormers over a long period of time to
so
gradually?
So what you do, ideally what you do is you soften them up first. So it's like a prolonged, this is why it takes so long. So what you do is, first of all, you kill off their friends. So they've got little symbiotic bacteria called Wolbachia that live inside them. So you put them on a month of doxycycline antibiotics and kill their friends, and you soften them up with what's called a macrocyclic lactase. So as you've said, one of the wormers that we commonly use. You do that first, then you use something called an adulticide, which you give by injection, something called melarsamine, which is a really nasty compound. It's very good at killing the adult worms. So you give a couple of injections, and then a month later you give another injection, and that kills those adult worms and clears them out. It's a very gradual process. The alternative is to do something called slow kill, and that's where you just use the wormers that we use all the time, every month. The biggest problem with that is it just takes much longer. I mean, it takes a year plus, and it's not actually any safer than just killing off the adult worms with the injections. So most vets will opt to use the adulticide injection. But it is another option. Say if you can't get it, or if it's not affordable, then this other alternative called slow kill is an option.
So going back to the pet owners, if somebody is wanting to adopt a dog from abroad and the charity isn't testing for heartworm, then first of all they really should, and secondly, if the heartworm result comes back positive, let's say for the antigen, so we know that adult heartworms are present, I guess that dog really needs to be treated before coming into the country.
Well, no, strangely, because you're looking at a long period of treatments with a risk of blood clots. So if as long as everybody's informed and the sort of new pet owner understands what they're undertaking, I actually wouldn't start treatment for heartworm until they were in the country that they were going to, just because of the associated risks of blood clots, and the fact it's going to take an awful long time anyway. So if you're going to be losing a few weeks, it's probably not going to make a big difference. I mean, the exception to that would be if they've already got clinical heart disease. If they've already got clinical heart disease, they shouldn't be travelling internationally. So, in that situation, you might have to treat them for, 6 months before they go. But if they're clinically well, I would get them, across the water or wherever they're going, and then, get them treated in their destination.
Good. So start the new life and the treatment.
Yeah,
and hopefully
absolutely. Yeah,
when they're here. Well, that's good. At least we can do that. But again, like you say, it's just ensuring that anyone taking on a dog understands what they've taken on.
Yeah, absolutely. I think this is the message that we're coming back to, is that all of these things are potentially manageable as long as you know what you're getting into. It's a case of sort of, knowing what a dog has ideally, or, cats as well, and then managing, as best you can, and sort of, monitoring with regular testing. But a lot of these parasites that we're talking about can be a rough old ride in terms of sort of treatment going forward.
So a real commitment. Right. So we've talked about brucellosis, which really should... Yeah. And we think may well become compulsory testing, but really should be tested for. We've talked about Leishmania and the consequences. So once you've got a positive test, that's it. The Leishmania is there as a chronic disease and may well flare and need to be managed throughout the dog's life, but they can have a great quality of life in between flares, and it doesn't restrict them at all.
Absolutely.
And although with Leishmania, there is the potential for dog-to-dog transmission, it's still very rare.
It's low, particularly if people are sensible. I mean, I have heard around the country of things like leash clubs, where you've got, groups of positive dogs all running together, free, in the countryside. What could go wrong? But if you've got a group of dogs together and they're meeting negative dogs, then whatever the mode of transmission, that risk is going to clearly go up. But I think as long as people are sensible in terms of hygiene are sensible in terms of sort of walking arrangements, sensible in terms of prolonged mixing with negative dogs, then I think, you know, there's no reason why that relatively low risk of transmission can't be managed.
Amazing. And then we had we touched very briefly on Ehrlichia, which is the tick-borne disease. But I guess you test for that if they've got it. You just sort of keep a mess.
Now, if they have got it, that you do want to hammer them with doxycycline in the hope you can get rid of it, and that you can do straight away and then retest them. Because we don't have the Rhiphocephalus tick in the UK, apart from the poor odd person who's had an infestation in their household because of central heating from imported dogs, but you know, by and large, we don't have Rhiphocephalus. You know, it's not really possible for Ehrlichia to be consistently transmitted. So that's not such a risk, but it's just the fact that chronic disease, fatal often chronic disease, can happen months or years after initial infections. So that's why testing is so important for Ehrlichia.
And which also brings up the point that in addition to testing for these diseases, you know, no reputable rescue would bring a dog in without tick treatment, although the tick treatment requirement was dropped by the Pets Travel Scheme, thanks Europe. And that did open the floodgates a bit to ticks, didn't it? I think that, well, they really should be treating for ticks before they travel.
Yes, I mean, just yes, absolutely, yes. And if they haven't been, they should absolutely be treated on arrival. But my only caveat to that is to remember that no tick product is 100% effective. So they're about 98% effective, but there are lots of places where you can be exposed to 50 ticks very quickly. Anybody who's walked in the Scottish Highlands, in the New Forest, will know how quickly you can be exposed to 50 ticks. So it's important as well that you physically check for ticks and remove any you find, and any that you find you get identified. And the biggest worry is Rhiphocephalus. So this tick will live in centrally heated homes. It doesn't like our chilly outdoor environment, but it can live in houses like fleas. And, you know, our native ticks can't really live in our houses because they take a long time to reproduce. The larvae need little birds or small furry mammals to feed on. So unless you're Sleeping Beauty or Cinderella and you've got little birds in your house flying around, it's unlikely to establish. Rhiphocephalus, though, the larvae, the nymphs, the adults will feed on anything that moves. So cats, dogs, you know, all good to go. And they can complete their life cycle in 3 to 6 months. So before you know it, you've got Rhiphocephalus ticks crawling all over your house. And no one wants that. You know, no one wants that. So just for that reason alone, tick biosecurity in these pets coming in is hugely important. So, you know, really needs to be taken very, very seriously.
So as vets, should we be recommending that any imported dog just has tick treatment repeated?
Well, I mean, you want to make sure, you know, you want to check what it's had and when it had it. You don't want to overdose it in terms of drug overdose.
Yeah.
But if there's any doubt, then you want to treat it. And, you know, if there's doubt, if you know what class might have been given, you can always use a different class of tick treatment as a backup, as a precaution. But, you know, I can't stress enough that Rhiphocephalus ticks can't be too dead. You know, I mean, they want to be very dead, and they're not easy to kill. I mean, there was a dog that was imported from Greece. It was a letter to the vet record that had been treated. I mean, perhaps it had, you know, with a very reputable product, and had 50 Rhiphocephalus larvae on its person. So, you know, that, you know, you just can't be too careful. You know, once they get established, they are incredibly tough to shift. So, yeah, absolutely.
So maybe that's one for any rescuers who are watching, in the fact that, you know, don't rely on, you know, obviously you're giving tick treatment, but don't 100% rely on it. You know, every dog that comes in, give it a full-on body in between the toes, in the ears, all of those places, like to hide. And if they're there,
absolutely, yeah.
remove them and burn them.
Bearing in mind that Rhiphocephalus likes living in kennel runs as well, and in sort of shelter type environments. And as a rescue charity, the last thing that you want is Rhiphocephalus establishing in your premises. So you do need to be very, very aware of tick infestations.
Can you use environmental control for ticks like we can for fleas? Do they respond to the sprays or anything like that?
They do, but they're tougher to kill, but generally. So one, famous case that was in the vet record, Hansford et al. In 2015, that was a Rhiphocephalus infestation that got into a house in the south of England, and the poor lady noticed these ticks coming out of cracks in the walls, and got on the big red phone, and then got sort of fumigators in. Even treating the dogs and fumigating twice, it took 12 months to eliminate the infestation. So yes, treating the environment is very, very important, but it can't be relied upon to just get rid of your infestation and jobs.
You may need to move out and burn the house down.
That's worth considering. Yeah.
Right, so let's read again. So we've done Brucellosis, we've done Lishmania, we've done Ehrlichia and their ticky friends. Then we've done Heartworm. So, and those were the big three, weren't they? They were Lishmania, Heartworm,
and Ehrlichia. Yeah.
And Ehrlichia. Thank you. So those are the big three. And then of course, any reputable rescue will be treating for ticks and fleas, but obviously, as we've just learned, we can't always rely on that. And then they should legally, these dogs need to be wormed as well, don't they?
They do. So Echinococcus Multilocularis is a really evil tapeworm. So this is a zoonosis. So the little tapeworm lives in dogs' intestines and does them no harm at all. But if they're infected through eating rodents abroad, then they will pass eggs in their feces that are immediately infective to people. And if we accidentally, get those eggs on our hands, if they get onto the coat and then they get onto us, we put our hands in our mouths, or, in endemic countries, it often gets onto fruit and, that are just picked and eaten, then you develop cysts in your body. And these cysts spread like cancer. So they'll bud off and they'll move. So they tend to hit the liver. They'll really invade the liver. A lot of people get liver failure as a result, but they'll bud off, they'll go to your lungs, they'll go to all sorts of other locations. If you get Echinococcus multilocularis, it will eventually kill you. I mean, it's going to shorten your life, and it's potentially going to make your life pretty miserable while you've got it. And the worry is that foxes are the sort of wildlife reservoir for this. We've got lots of foxes in the UK. The microtine vole is the most common intermediate host that carries the tapeworm cyst. And great quiz question. That's the most common rodent in the UK. So we've got lots of reservoir. And if it came in an infected dog, because of the incubation period in people, it'd be 10 to 15 years before we got the first human case. So by the time we realised it was here, it would be far, far too late to get rid of it. That is aside from the individual risk that a positive dog imported would present to the owners that had it. So where I'm heading with this is that the compulsory tapeworm treatment is essential to maintain and to be observed. But there is a window, so you can have this treatment 1 to 5 days before you come into the country. And the sort of drug that we're using to treat the worm is eliminated from the body very, very quickly. So they can get reinfected before they come in. So for that reason, it's very important to tapeworm treat them again within a month after they arrive. And the tapeworm treatment we're talking about is very cheap and cheerful. It's very well tolerated. It's very safe. Take it because, you don't want your liver to fall out in 10 to 15 years. So give it to your dog and then you're just safe as houses. That's
Yeah, and I think that's one thing that is often, we are going to wrap up in a minute, because I said to Ian, this will only take half an hour. Now, I knew that was
I'll talk all night if somebody visits.
I know.
So,
we could, I could listen to you, because it is fascinating, and you're making what can seem like a bit of a hugely complex issue actually quite understandable and simple. And I think a lot of the veterinary surgeons watching will be taking notes. I
appreciate the same with orthopedics when I go to an orthopedic surgeon. So it's
we all have our areas of speciality.
Absolutely.
But I think that's the point, is that a lot of people don't realise that any pets travel scheme, any requirements currently for the dogs coming into the country, has absolutely nothing to do with dog health or the health of the dogs in this country. It's all to do with human health. That's why they're vaccinated against rabies. That's why they're wormed, not to eliminate tapeworms for the dog. It's to stop this horrible, nasty Echinococcus creating tapeworm come in and infect us. And if brucellosis becomes notifiable or compulsory, again, it's not for the dogs, it's for the humans in the country. And I think that's really important, and that's why so many of these diseases are so, all these other ones that we're talking about are so prevalent and so sort of slightly underestimated, is because it's not, there is no government regulation, there are no overarching rules, there is no pattern that everybody has to follow, because all of the things that we're talking about only affect the dogs in the main, and that's, nobody in officialdom actually cares about that, which is why we have to take it on ourselves to be responsible. And I mean, we've not even touched on nasal worms.
Nasal pentastamids. I haven't even got, look, I've got my little friend here. This is a Dirofilaria repens. I don't know how well it's going to show up if I can, but there's a little Fred 14 centimetre long worm in there that crawled out of a castrate incision, a dog imported from Corfu. And that again is a worm that could quite easily establish in the UK in our mosquito population.
So that's the skin worm.
So if there could be one quick take-home message, because we haven't got time to cover eye worms, skin worms, nasal pentastamids, it would be, if you're a vet or a nurse, make sure these dogs get a very thorough clinical exam. And if there's an organ that's affected, if they've got conjunctivitis, if they've got a nasal secretion, they've got nodules on their skin, stop and think, well, what parasites are in the country that this dog's come from? What could we have here? And if you're not sure, get in touch with me, or get in touch with someone else with a similar interest, and we'll help. But by doing a sort of clinical exam and recognizing some of these signs, you'll be amazed what you can pin down. And some of these worms, like eye worm, sort of skin worm, they're very, very straightforward to treat, but you have to know that they're there. So that
worm can't survive.
That clinical exam is crucial, and then you can get on with the worm killing, which is the most satisfying bit. Really, that's good to go.
I cannot even begin to imagine a worm crawling out of a surgical wound and just waving at you. That would.
Nothing that exciting has happened to me recently. They don't come to Fleetwood. It's almost like they can sense my evil presence. They just don't come.
Okay, right. I have one final question, seeing as we're touching on all these crazy worms, are the wormers that we give for tapeworms for dogs travelling over, are they going to kill skin worms and eye worms? And
no. So the compulsory tapeworm treatment is just that. It's for tapeworms. Now, for pet travel, we're going to recommend heartworm prevention, and heartworm prevention will kill a lot of these worms. So it's a bit sledgehammer. It's not very nuanced, but a lot of exotic worms will be killed by macrocyclic lactones, which are this type of wormer that prevents heartworms. So in terms of dogs traveling abroad, then there's preventative treatments you can give that will probably cover most of these things. The problem is in imported dogs, they've often already got them, and then they have to be sort of targeted individually in different ways.
So if they come, because I spoke to a colleague, a friend of mine, I was at university with him, and a dog sneezed out a nasal worm in front of him. Yeah. And the first thing he did was picture and send it to me. It literally made my day. But if that dog had travelled and been given the official worming treatment, it's not a case of that worming treatment failing. It's a case of that worming treatment does not.
Well, to be fair, the one up the nose, Linguatula serrata, doesn't tend to be picked up by dogs going on holiday because they've got to eat raw viscera. So unless they're having a hell of a holiday and you're just letting them eat anything that moves, then
I think this was a
so that's something that tends to be in imported dogs that are coming in. But the skin worm and the eye worm are transmitted by mosquitoes and fruit flies, respectively. And if you've got, that preventative wormer in place, then, you're probably going to be okay. But the fact is that, dogs that are imported, unless they're very young dogs, have lived in endemic countries for a long time. A lot of them have lived, they've been rescued. So a lot of them have been lived as street dogs, or they've had multiple homes, or they're strays. They're not going to have had the preventative treatments that many of our pets enjoy. And as a result, some of them are inevitably going to have some of these parasites. And that isn't, I completely understand, people still want to help them, still want to adopt them. That's wonderful. It's just so important to know what you're getting into and knowing what other little friends, you might be inheriting at the same time. And then, they can be managed or they can be eliminated appropriately.
Okay, right. We nearly need to finish, but I just have to know the answer to this question. If as a veterinary surgeon, I see a dog with skin worm or eye worm, how do I just treat it with ordinary wormers, or do I? So
skin worm, macrocyclic lactone specifically. So like moxidectin or milbemycin, is going to do the trick. Eye worms, there are sort of like, again, licensed products that will eliminate it, but you also need to physically flush out the worm as well, to speed things up. So from the conjunctival sac, that is a beautiful moment. The dog's going to feel better, and yet they're swimming away. It's wonderful,
disgusting and fascinating at the same time. Okay, well, that's really helpful.
It is, yeah.
Okay, so if anybody has any further questions, please direct them towards Ian, especially the vet professionals. I think we all know where we can find you. Ian,
absolutely, they're easy to find. So if you've got any questions, put me down.
We have to stop there. We have had a few questions come in, but I think we've managed to cover them all. So if you guys are still watching, thank you so much for sticking with us.
Thank you. And I really appreciate the interest. It is a very important issue. So thank you for sticking with us.
I think a lot of people are really interested because we're just so desperate to do the right thing, to know how we can help these dogs, to know what we're dealing with when we've got them, to know what we should be checking for before they're coming in, to know what positive results mean and whether that is a terrible thing or a manageable thing. I think that there is a bit of a dearth of information around this subject. So thank you so much, everybody, for sticking with us.
Yes, thank you. Yeah.
I have even more exciting news. Ian and I will be back in a fortnight talking again about worms. But this
what else? What else? Yeah.
Well, I really want to pick Ian's brain on worm egg counts particularly. And I see them recommended a lot as an alternative to worming our pets and to all those, and we shouldn't be worming, we should be worming. And I just want to know from the guy who really knows about worm egg counts. So if we manage to talk for an hour on worm egg counts, that possibly will be
impressive, but I am up for the challenge.
So hopefully that will be a bit shorter, but we're taking next Monday off because of the bank holidays, and then a week later I'm going to be here, same time, same place, chit-chatting about worm egg counts, which, I mean, if you're interested in them, you're going to find them interesting.
I'm looking forward to it already. So, so will everyone else, I'm sure.
Excellent. And, I've had a great time, Ian. Thank you so much. I am really, really grateful for you.
My pleasure. My pleasure.
It has been so fascinating. And yes, right. Well, let's say goodbye. Bye, everybody. Thank you so much for tuning in.
Thanks for tuning in. Oh, this hand. Bye.